How would you assess the digital health landscape in Chile at the moment?
I've seen that many of the collaborations that started in the times of the pandemic have advanced, but they haven't advanced as fast as we thought they would, because many of them hit a regulatory wall in many cases. Like I was telling you, we were waiting for about 2 years on a pronunciation from the healthcare ministry to state whether we could use the cloud to store Chilean patients that go to the public sector on the cloud. And the pronunciation came like 4 or 5 months ago. So many
What
projects
did you do?
currently.
What did
Mhm.
you do in the meantime? Like, how did you store data? Did you just start a
We
company?
don't. Yeah. Many of these projects were just waiting to be implemented. Like we advanced the other parts of the implementation process. For one, we started really nailing down, like polishing the the problems that the institution currently have. Many of these conversations were about 2 years, 2.5 years, talking to the institutions on which are the problems that they currently have and what type of services could we provide to understand and address those problems and speed up the patient's journey. Um, but those discussions were waiting for these regulatory definitions to happen and some regulatory approvals as well. But then these regulatory decisions usually take a long time. So, and that's why we probably see that these Epic or Cerner like corporations in Latin America, when they say that they are going to do a digital transformation for a public service, that usually takes between 3 to 5 years, you know?
I was just thinking that um, what exactly happened to Venezuela? You know, you were building and covered a lot of the market with your EHR. Are you still present there at all, or did you completely pivoted?
No, we tried. Like in 2021, we gave our platform for free for the Venezuelan Anti-Cancer Society to use in their facilities. And there was no work for them to start using the platform because they didn't have good internet access. Venezuela still depends on CanTV, which is the national telecommunications company, to provide internet, because private internet is quite expensive. It can run $400 to $1,000 per month. This type of charitable organizations, they don't have that kind of budget. And even if you pay for a private vendor, then internet is super lagging. Like usually, what we do in a vendor, like a batch process that we run in 30 seconds in Venezuela, can take 5 to 6 minutes. We have experienced that with the internal development team.